Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about diabetic retinopathy. We are going to see what is diabetic retinopathy is, what are the symptoms of it, causes, complications, tests, treatment and precautions. So, let's get started. What is diabetic retinopathy? Diabetic retinopathy is an eye disease caused by diabetes mellitus. This happens when high blood sugar levels cause damage to blood vessels in the retina. There are two types of diabetic retinopathy. The first one is non-proliferative diabetic retinopathy and the second one is proliferative diabetic retinopathy. Non-proliferative diabetic retinopathy has three stages: mild stage 1, moderate stage 2, severe stage 3. Let us discuss a little bit more about these stages in detail. Mild stage 1. This is the earliest stage of diabetic retinopathy, characterized by tiny swellings, bulges in the blood vessels of the retina known as microaneurysms. Moderate stage 2. At this stage, the tiny blood vessels further swell up, blocking blood flow to the retina and preventing proper nourishment. Some of the blood vessels in the retina will become blocked, leading to hemorrhages. Severe stage 3. During this stage, a larger section of blood vessels in the retina become blocked, causing a significant decrease in blood flow to the area. More blocked blood vessels which lead to areas of the retina no longer receiving adequate blood flow. And the stage 4 is proliferative diabetic retinopathy. The lack of blood triggers a signal to the body to start growing new blood vessels in the retina. At this advanced stage of the disease, new blood vessels continue to grow in the retina. These blood vessels, which are thin and weak and prone to bleeding, cause scar tissue to form inside the eye. This scar tissue can pull the retina away from the back of your eye, causing retinal detachment. A detached retina typically results in blurriness, reduced field of vision, and even permanent blindness. Now let us discuss about the symptoms. Blurred or distorted vision, new color blindness or seeing colors as faded, poor night vision called as night blindness, small dark spots or streaks in your vision, trouble reading or seeing far away objects. Now let us discuss about the causes. Diabetic retinopathy is caused by high blood sugar levels due to diabetes. Diabetes damages blood vessels all over the body. The damage to your eyes starts when sugar blocks the tiny blood vessels that go to your retina, causing them to leak fluid or bleed. To make up for these blocked blood vessels, your eyes then grow new blood vessels that don't work well. These new blood vessels can leak or bleed easily. Now let us discuss about the complications of diabetic retinopathy. The first complication is vitreous hemorrhage. The new blood vessels may bleed into the clear jelly-like substance that fills the center of your eye. If the amount of bleeding is small, you might see only a few dark spots. In more severe cases, blood can fill the vitreous cavity and completely block your vision. The next complication is retinal detachment. The abnormal blood vessels associated with diabetic retinopathy stimulate the growth of scar tissue, which can pull the retina away from the back of the eye. This can cause spots floating in your vision, flashes of light, or severe vision loss. Next complication is the macular edema. Macular edema happens when blood vessels leak into a part of the retina called the macula. This makes the macula swell, causing blurry vision. Next complication is the cataracts. A cataract is a clouding of the lens in the eye. Left untreated, cataracts can eventually lead to blindness. People with diabetes are more likely to develop cataracts at an earlier age and suffer visual impairment faster than those without the condition. Next complication is the glaucoma. This is a group of conditions that can damage the optic nerve. The optic nerve transmits signals from the retina to the brain for processing. Glaucoma is often a result of increased pressure inside the eye. The risk of glaucoma in people with diabetes is significantly higher than that of the general population. Next complication is the blindness. Diabetic retinopathy, macular edema, glaucoma, or a combination of these conditions can lead to complete vision loss, especially if the conditions are poorly managed. Now let us discuss about the tests done for diabetic retinopathy. The first test is visual acuity testing. This test measures how well the eye can focus and see details at near and far distances. It can help find vision loss and other problems. Next test is tonometry, a standard test that checks the intraocular pressure inside the eye. Pupil dilation, an examination where your pupil is widened with eye drops for a close-up of the eye's lens and retina. Ophthalmoscopy, an examination where your doctor looks very closely at the retina using a special magnifying glass. Fluorescein angiography. After your eyes are dilated, a dye is injected into a vein in your arm. Then pictures are taken as the dye circulates through your eye's blood vessels. The images can pinpoint blood vessels that are closed, broken, or leaking. Optical coherence tomography, a test where light waves are used to make detailed images of the retina. Now let us discuss about the treatment. Eye injections. In cases of diabetic maculopathy, injections of a medicine called anti-VEGF may be given directly into your eyes to prevent new blood vessels forming at the back of the eyes. The main medicines used are called ranibizumab and aflibercept. These can help stop the problems in your eyes getting worse and may also lead to an improvement in your vision. Next treatment option is the laser treatment. Laser treatment is used to treat new blood vessels at the back of the eyes in the advanced stages of diabetic retinopathy. Laser treatment involves shining a laser into your eyes. You will be given local anesthetic drops to numb your eyes. Eye drops are used to widen your pupils, and special contact lenses are used to hold your eyelids open and focus the laser onto your retina. Treatment can help stabilize the changes in your eyes caused by your diabetes and stop your vision getting any worse. Next treatment option is the steroid implants. If you cannot have anti-VEGF injections or they have not worked for you, you may be offered an eye implant called an intravitreal implant containing a steroid medicine called dexamethasone. This is a tiny implant that's injected into your eye using a special applicator by giving local anesthesia. The implant slowly releases dexamethasone over a few months. This reduces swelling in your eye and can help to improve your eyesight. The implant eventually dissolves, so it does not need to be removed. Next treatment option is vitrectomy. If you have advanced PDR, your ophthalmologist may recommend surgery called vitrectomy. Your ophthalmologist removes vitreous gel and blood from leaking vessels in the back of your eye. This allows light rays to focus properly on the retina again. Scar tissue also might be removed from the retina. Now let us discuss about the precautions. Get your eyes checked regularly, maintain healthy blood glucose levels, manage your blood pressure and check cholesterol levels. Follow a healthy diet, avoid stress and get enough sleep. Stay hydrated, exercise regularly, quit smoking and alcohol. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.